Hello everyone, let's move on to the next bit of our history taking. We'll be talking about the treatment history, the past history, as well as the family history of the patient. These three things are very essential. Though they are not frequently asked upon, you have to include them in your history. So let's talk about first the treatment history of the patient. When the patient has come to you, of course, maybe you were there at the emergency or maybe you were there in the ward. Patient has received some sort of treatment, and whenever you're presenting a case in real life or in examination, you have to include the present treatment history of the patient. That means what is the treatment that the patient has received. Maybe you can talk that patient came to us with altered sensorium. Not altered sensorium technically, patient came with us with violent behavior. That might indicate the altered sensorium, and patient had taken alcohol. So it is something like a delirium. And for the treatment of delirium, we have given him maybe a benzodiazepine. Maybe we have given him D25, maybe we have given him D10, and we've also given him thiamine. So these are the few treatment modalities for alcohol withdrawal that we usually give. So you can include that in your treatment history. So this is the treatment history of the current state. That means when the patient has come to you, what are all the treatments that you have started. Now, when you are just given a case like that, the case sheet might not be available to you and you might not know what exactly treatments are given during the exam time. So at that point, you can omit the treatment history part completely for the current ailment. But for the past ailment, whichever the patient has suffered before, you have to write down the treatment history as well as what are the relevant past medical as well as surgical histories. So what are some things which are very common? So history of blood transfusion, you cannot miss. This is very, very essential, especially if the patient is female, Rh negative pregnancy, you all know the complications of it. So blood transfusions is very, very essential whenever you're writing the treatment history. Secondly, you have to write down the different admissions that the patient has gotten previously and why they were there for, and is it related to the current state. For example, the patient might be admitted 2 or 3 years back with the history of sudden loss of consciousness or maybe irrelevant speech, and that might indicate a TIA, that is the transient ischemic attack. And today the patient might come with you for hemiplegia or weakness of one side of the body. So that TIA might have gotten converted, maybe another attack after that TIA might have been gotten converted into a pakka stroke. So those are some of the relevant treatment history that you have to write. You have also got to write about what are the drugs that the patient is currently taking. So drugs for DM, drugs for hypertension, drugs for thyroid diseases, which are very common. If the patient is female, if they are using any OCPs currently, and what are the doses of each of these following. Treatment history should include all of this. Mind you, this is very important. In real life, so it is super duper important. Maybe in the exam hall, not so much because you don't have access to all the drugs that the patient is having, but if you include it, it's a charm in your examination. In here, if it's a pediatric patient, you can also include the immunization history of the patient as well as any surgeries that the patient might have gotten. So maybe the patient got operated for some cancer a few years ago, now is presenting with jaundice. You can think about recurrence of that cancer or metastasis of that cancer. Maybe the patient got operated for acute appendicitis, or maybe the patient got operated for obstruction. So these are the few conditions which can be presenting from surgical to a medicinal side. Next, after treatment history, we move on to the past history of the patient. This is very essential because a lot of the people who are coming to your OPD definitely already have some disease in the back of their head that is going on, and that is where the past history is going to come into play. So let's talk about what are the different past histories that you have to elicit. Firstly, childhood disorders are very common. So all the rashes, so measles, mumps, rubella is very important that you ask about it. You can also ask about chickenpox. If the adult who is coming to you right now had chickenpox before and now is coming to you with severe pain on the face plus vesicles on the ear lobule as well as inside the tympanic membrane, you might think about Ramsay-Hunt syndrome. You might think about shingles. So these few things are very important with respect to the childhood diseases. Apart from that, obviously hepatitis B, rheumatic heart disease, some fever, joint pain that the patient might have had previously. Next, chronic diseases like diabetes, hypertension, thyroid disorders, asthma, COPD, bronchitis, very, very common in India. Never ever miss tuberculosis as one of the most important past histories of the patient. You will never know how tuberculosis presents to you. It might come to you as a CNS case, as an RS case, as a GIT case. It might present to you like anyways. Never ever miss tuberculosis, negative tuberculosis history in your past history. Please remember this, my friends. As important as DM and hypertension, in India, almost is said that 1 out of every 3 people is infected with tuberculosis, is just waiting for us to reactivate. It might happen that you or me have also got tuberculosis within us. It's just waiting for us, our immunity to go down to reactivate. Very essential that if when you have a patient of heart disease, you have got to elicit the history of rheumatic heart disease previously because it could lead to infective endocarditis. So rheumatic heart disease, what are the various histories? So joint pain is very essential. Fever, sore throat, these are the few pointers towards rheumatic heart disease. Lastly, if a patient comes to you with jaundice, you have to elicit the history of upper GI and lower GI symptoms. So bleeding varices that will present to you as hematemesis or melena. You can also get different things like ascites, which is repeated swelling of the abdomen, and you might also get the history of tapping, which is done for the ascites. Lastly, essential to note is is the history for trauma in past history. If the patient has already suffered some road traffic accident or some other trauma like trauma to the chest, abdomen, which could include some of the findings which are relevant to our case. That was all with respect to your past history. Now let's move on to family history. In family history, my dear friends, you have to draw a pedigree chart. You might have learned about what is a pedigree, how to draw it in 11th and 12th, and now you have to draw it again. Whenever you are especially taking a case of pediatric or a neonate, pedigree is super duper important. Now there are a lot of diseases which run in the family, and how do you ask for the history of it? You ask if a person who has jaundice, you ask, is it happening to in your family as well? That might give you an idea about inherited jaundice conditions that are commonly present. Secondly, if somebody has hemolytic anemia like sickle cell anemia or thalassemia, these are also present as inheritable traits. Now there are 4 or 5 different patterns of inheritance that you should know, and the pedigrees of it we should know because they can be asked in the viva. So you have to talk about with respect to the family history of the patient in the first degree relatives, the second degree, and the third degree relatives. And whenever you're drawing a pedigree, it should be at least a 3-generation pedigree. That means the parents, the grandparents, as well as the children. So whoever is coming to you should be present with 2 or 3 generations above. So like I was talking, there was 5 different patterns of inheritance that you should all know. First is autosomal recessive, autosomal dominant, X-linked recessive, X-linked dominant, and lastly, you've got mitochondrial inheritance pattern. If you're a student of Marrow, you might already know the mnemonics are A, B, C, D, E, F, G, H. So you can use it and find out what are diseases which are autosomal recessive. So talking about the autosomal recessive conditions, you must never forget beta thalassemia, alpha thalassemia, sickle cell anemia, cystic fibrosis, Wilson's disease, hemochromatosis. These are just a few autosomal recessive. For autosomal dominant, you have to remember specifically the conditions related to the bone, the cartilage, all of them are mostly autosomal dominant. So things like achondroplasia, Marfan syndrome, hereditary spherocytosis, neurofibromatosis, tuberous sclerosis, these are all autosomal dominant conditions. The X-linked recessive condition, my friends, can be colorblindness, they can be hemophilia, they can be G6PD deficiency, and the X-linked dominant, that can be red roses for all children is the mnemonic. So Rett syndrome, then we've got Charcot-Marie Tooth disease, and 2 more diseases which probably you will never see in your OPD. Then we've got the mitochondrial inheritance. These are the few diseases of mitochondrial inheritance that you can keep in mind. One of the most important over there is Leber's hereditary optic neuropathy as well as MELAS, that is mitochondrial encephalopathy, lactic acidosis, and stroke. That is all with respect to family history. Please make sure that you learn these inheritance patterns by heart. They will help you out quite when you're answering the viva, as well as they will help you out quite a lot in your national level examinations like NEET, PGNI, and ICET. So to rewind, whatever we have studied so far, we have talked about demographic data in which we have talked about the name, age, sex of the patient, the occupation, as well as where they hail from, that is the address, the socioeconomic status, the date of admission, and the date of treatment. Next, we talked about the chief complaints, the HOPI. All are very essential. The chief complaints, you have to write the 2 things or 3 things max to max in HOPI. You have to just elaborate on those things very well. Next, we have gone over towards the negative history, which is as essential as the HOPI itself. Next, we go over towards the treatment history, the current treatment history, as well as the old treatment history, including the medications and the surgeries. Next, we go on over towards the past history, which is very essential in India. Tuberculosis, you never have to forget. The family history, I've told you all the inheritance patterns. And now this is the where most of your history taking will lie. And now we move on to the other small histories that you have to take in your history taking.